Hello everyone, today we're going to talk about dental anesthesia and sedation.
That's what they said.
We're also going to talk about how these tools can help you with your dental anxiety and phobias.
I'm only going to say this one more time, sir. Calm down.
I'm calm!
This is Dr. Tamisha Denis, and this is The Modern Smile. Going to the dentist is right up there with phobias and fears with heights and snakes and spiders and speaking in public in tight spaces.
Throw your arms across your eyes and scream, man. Scream for your life.
For some reason, going to the dentist causes people to have a lot of anxiety. Now, some of that anxiety comes from past experiences. Many people as children went to the dentist in a time where dentists were not very compassionate to their feelings. If they felt something, they said, tough it out and keep going.
Open. Now, let's see what the damage is, shall we?
Some people didn't have anesthesia for painful procedures, or maybe they had past experiences that had very painful abscesses and the dentist muscled it through, got on top of their chair and caused all kinds of trauma. I have heard so many stories being a dentist about past experiences, and I try to tell my patients it's a lot easier today. The main reason that it's a lot easier today is that we have so many technologies that help things to be less painful in general. Also, dentists are a lot more compassionate than they used to be. Now, dentists tend to listen to their patients a lot more, and when you say it hurts, guess what we do? We stopped. So I feel like the words put me to sleep and anesthesia are used very loosely. When it comes to the layperson, someone who's just going to the dentist, they say put me to sleep, but they don't really understand what that means because anesthesia is in certain levels. So we're going to talk about the different levels of anesthesia, and when you have your upcoming appointment, you can talk to your dentist about what your options are and what they have available in that office. So the first level of anesthesia is called local anesthesia, and local anesthesia just means that I'm going to numb the area that we're working on. So we place something called benzocaine or topical anesthetic, and that topical anesthetic is placed over the area that we're going to give you a shot. So for example, if we're going to do the upper left or the upper right or whatever section we choose, we'll place the topical anesthetic usually on a little cotton tip that looks like a Q-tip. We swab it up, we put it on that area, and what it does, it takes the edge off so you don't feel the pinch so much. So if you can see, we have the needle. There's a long one and a short one, and it really is to get access. If you look at the needle very carefully, the tip is so tiny, and everybody's so obsessed with what that does, but the reality is the needle is not what causes you pain. What causes you pain is the liquid that's getting pushed into the area in a tight space, and it pushes on everything, causes pain. I tell all my patients when I give them a shot, if you count to 5 in your head, after 5, it will be done, because as the anesthetic enters the area, it numbs it simultaneously. So if you could take a nice deep breath, I say breathe in, and as you feel the pinch, breathe out, and usually it goes right away. So if we're talking about levels of anesthesia, if I numb you on the upper right, only the upper right will be numb. If I numb you on the lower, only the lower will be numb. Let's say I numb you on the upper right, then you might feel your lower eyelid get numb, or even the tip of your nose, or right about here. So this whole section might feel numb. Now we're doing the bottom depending on what kind of anesthesia, and dentists have different kinds of places they'll place anesthesia. For example, if we do something called a mental nerve block, you'll feel numb right in here, your little chin area, and all along your gums on the bottom. Or if we do what we call an inferior alveolar block, without getting too complicated, you'll feel your tongue feel heavy, and your tongue will feel fat, and it'll be very difficult to speak. You'll slur your words a bit. You might even feel tingling and numbing numbness in your ear. So that is called local anesthesia. We can pretty much do any procedure just with local anesthesia. Now, this is where a lot of people get confused. Why do we have to get put to sleep? We get put to sleep for anxiety. We get put to sleep for fears and phobia. It is not necessary for the majority. I would say 99% of dental procedures do not require you to get put to sleep. The reason we talk about getting put to sleep is because you're scared. And naturally so. Again, like I said, maybe it's past experiences that were bad, or maybe you have the fear of the unknown. But we are putting you to sleep for this. I always say for this, not for your mouth, for this. Because no matter what kind of anesthesia we give, kind of anti-anxiety things we do, unless we still have to numb you in your mouth, because no matter how asleep you are, if you're in pain, you're gonna jump up and get out of pain really quickly because your body has defense mechanisms to say, someone is hurting me. So the reason I'm saying that is because we're going into the next phase. The next phase is something called nitrous oxide. So nitrous oxide, better known as laughing gas, is a great option to help to calm some of your fears. And if you ever had gas before, you gotta try it. It's really cool. And the reason it's called laughing gas is because it actually makes you feel giggly. So when I start to talk and I see that you're thinking that most of the things that I'm saying are quite funny, then I know the laughing gas is working. Another sensation you'll feel is a little tingling in your fingers and in your toes. Sometimes you'll feel like your just body feels really nice and loose and relaxed. And that's what laughing gas does. It takes the edge off. It makes you not care so much. So yes, you still feel the shock because you still need local anesthesia in your mouth, so you still feel the shot. However, it just does, you don't care so much. So again, laughing gas is for the mind. It doesn't take away the pain in your mouth, and that's so important. You won't know how many times somebody comes in and they think because they're getting laughing gas, they don't need a shot. That is just not true. Like I said before, if you get laughing gas and I try to pull your tooth out, it doesn't matter how relaxed you feel. You'll snap out of it in a second because your body's gonna say, this is not right. So laughing gas, just nice, giggly, relax your body, your muscles feel loose, just a lot of tension leaves your body. Now, some people love that sensation, some people don't like it, but there are other choices. The next choice that I'm going to talk about is enteral or oral sedation. Oral sedation means just that. It means that we can give you some sort of pill to reduce anxiety, and there's lots of different ways that we can do it. One of the common medications that we use for oral sedation is Valium. Sometimes we'll use a Xanax, and a lot of them are just to reduce anxiety. So I usually in my office will use very, very low dosages of those medications. And sometimes what I will do is I will tell somebody if they have a morning appointment, they'll take a pill before they go to sleep. Because lots of people love to dream about the dental appointment they're going to have the next day. So it helps them sleep a little better. Then they come in the morning, and 1 hour before their appointment, they will take another pill. Usually at that point, I'll enter the room. I say, hey, how you doing? You feeling pretty good? Oh, doc, I feel so nice and sleepy and groggy and good. And I say, great. If they say, ooh, I'm still really tense, and then I say, maybe we should take another one. And of course, because I use such a low dosage, we monitor that together. There's a lot of different factors as to how those medications will affect you, because some people take a Xanax all the time. So when I give them a Xanax, it's nothing to them. Or some people have very low tolerance, and just a little bit goes a long way. It has nothing to do with your weight. I've seen a big man go numb just like that, and that stuff takes them down, and someone who's nice and skinny and 90 pounds and 5 feet, and they don't feel like the medication is doing anything. So it has nothing to do with weight, even though we use weight to kind of gauge how much we should give. Everybody's metabolism, their personal chemistry is very, very different. So that is oral sedation. Again, a Xanax, a Valium, an Ativan, something of that nature. You take the pill. Now, the disadvantage of that medication, unlike laughing gas, once you breathe off the laughing gas, it's over. You can go to work, you can do your regular thing, but when you have a pill like that, it takes a while for your body to metabolize what you've put in it, and you might end up being groggy for the rest of the day. So a lot of times, if you have a morning appointment, it's great because you get a good night's sleep and you come in nice and sleepy, and if you didn't sleep very well anyways, then you sleep during my procedure, but it is not guaranteed that you fall asleep. Now, if you do it in the evening, maybe you have a good night rest and you'll wake up the next morning. So your dentist will help you figure out how to use oral sedation. Now, the next kind of sedation we're talking about on a deeper level, we're talking about IV sedation. Now, most people, when they think of the level of anesthesia or sleep that they would like to have during their procedure, they're really thinking of IV sedation, because IV sedation is one that, number one, will make you either sleep or make you feel like you're sleeping. And the reason I say feel like you're sleeping, I personally have been trained in IV sedation, and I have done sedation, and I see that the person is talking to me like they're regular, but the next day they do not remember anything. So even though they seem lucid, meaning they're semi-conscious, or they will still respond. If I tell them to open, they'll open. If I say to close, they'll close. If I say turn their head, they kind of are responsive, but they really are not completely responsive. So that's a deeper level, but you're not completely sedated. So you may sleep because you feel very nice and relaxed. A lot of those medications are like Versed. They're called benzodiazepines, and those things also make you very relaxed. There's propofol, there's fentanyl. So we're talking about on a much deeper level, and that is what people mostly refer to when they're talking about sleep dentistry, or they're talking about being put to sleep. IV. Now, IV is not something to be taken lightly, because it does require some of your nervous system to go down, and there's more risk involved with that. So the more deeper you go with dental anesthesia or dental sedation, the more risk involved. So you have to be cleared health-wise. You have to be a healthy person to do that. Now, do you need to be put to sleep to take your wisdom teeth out or to have an implant? The answer is no. The reason, again, and I'm going to keep saying this probably 100 times during the video, is that the reason we do that is just for anxiety. I take wisdom teeth out all the time with nothing but local anesthesia, and people are just fine. As you can tell, I'm a talker, so I usually talk them and calm them down to make them feel comfortable. So IV sedation is the next level. That's also, some people will call it twilight sleep. So they're kind of like in and out. Like I said, you're kind of semi-conscious. You kind of know what's going on. Now on the back end, you may not remember a thing. Now, the next level of anesthesia is called general anesthesia. General anesthesia is the deepest anesthesia that you can get. That means you are out. You know nothing. And this is the kind of anesthesia that they use in most general surgeries for the body and things like that. So for general anesthesia, on a deeper level, you have less reflexes, responses that you can. Again, that one, you usually don't remember anything at all. You usually don't remember anything at all. You go home, you wake up, you say, what happened that last day? Again, still just for your mind. There are very, very, very few procedures in dentistry that kind of require general anesthesia. And the reason, sometimes, let's say you have an orthognathic surgery, which is a very major surgery, or some sort of like deep oral surgery that's not just pulling a wisdom tooth, they may require general anesthesia. So those are all the levels of anesthesia. Hopefully you understand a little bit better what your options are to help you conquer your anxiety and help you do your dental work. We make all of these things just to help you to get your work done. So get brave and go and find out what your options are so you can get through your fears. I will say this, The reality is, no matter how much you think this thing is going to be the scariest thing you've ever experienced, most of the time it's not as bad as you imagine. I tell my patients, I can't possibly live up to all of the fears that you've created of what's going to happen today, because usually you think it's going to be god awful and you're like, oh, that's it, I'm done. And that's usually how it goes. But there is nothing wrong with exploring the options of how you can get a little bit more relaxed in the dental chair. Sometimes I'll have somebody and the first visit will do all this nitrous oxide and oral sedation. The second time they're like, oh, I'm fine, I don't need that. And guess what? They are, because they start to trust me and know that I have no intention to hurt them, and that all I want is to be able to get the work done in the less traumatic way possible. All right, there we go. This is Dr. Tamisha Denis. And if you enjoyed the content that you heard, make sure to give me a nice like and a thumbs up. And don't forget to subscribe to the channel for more information like that. Make sure to comment. I try to respond to all of the comments as much as I can. And let me know if there's some other videos that you would like to see me make. Thank you for watching.